Good afternoon, everyone. Before we provide our latest updates on the response to COVID-19, I have some, unfortunately, very sad news to share. It is with a heavy heart that I announce our city government has lost 2 more employees to COVID-19. Early this morning, Will Martin, a plumber with the water department, passed away following a 2-week fight with this disease. He worked out of the department's central district and was known as an absolute prince by those who were lucky enough to work with him. I'm also here to report that Chicago lost firefighter Ed Singleton, a veteran of the fire department for over 25 years, who succumbed to complications from COVID-19 last night. Both men were dedicated public servants who loved their city, and both deaths serve as another painful and tragic reminder of the seriousness and the danger of this terrible disease. Our hearts go out to the families and loved ones of these 2 men who themselves are struggling in this terrible moment. Since even before COVID-19 arrived in our city, one of our North Stars has been ensuring our response is rooted in science and the latest available data. But with that has also been our simultaneous commitment to making that data as transparent and available to the public as possible. The term, "we are all in this together," means many things, including the right for residents to know not only what their elected leaders are doing, but the reasons why we're doing it. These values have shaped our decisions every step of the way, whether from our first measures regarding increased screenings at O'Hare, through our canceling parades and large public gatherings, to more recent actions regarding the McCormick Place build-out and the closure of our lakefront. All of it has been science and data-driven, and all of it has been done with the singular aim of halting the spread of this disease, moving our city forward, and saving lives. It is in that same spirit that I would like to use this opportunity to update the public on the latest data we are seeing, our steps forward in combating this disease, and some of the things that we will need to happen in order for us to begin lifting restrictions and getting back to a new normal. First and foremost, I am happy to announce that Chicago is beginning to flatten the curve on COVID-19 cases. This is due to extensive cooperation from our residents and businesses, as well as the incredible work of our city agencies and partners. These gains represent some of the most hopeful signs yet that we are on the right path and our work is paying off. Each and every one of us should be very proud of this, especially when considering where we thought we'd be at this point just a few weeks ago. Recall that back in mid-March, cases here in Chicago were doubling every 2 to 3 days. If we had continued on that path, we would be looking at upwards of 2,000 deaths and over 62,000 cases today. Instead, the levels are now thankfully only a fraction of that. However, we should not confuse improvement with success. Despite our recent gains, I want all Chicago to hear me loud and clear. We still have a long way to go. Many things are needed for us to lift the restrictions we have placed on our city and be comfortable to reemerge from our stay-at-home order, a decision that is ultimately in the hands of Governor Pritzker. The new, never-before-released data we are providing today includes details on hospital capacity, case rates, and community mobility, all of which provides invaluable insight into where we are and where we need to go when it comes to mitigating and eventually recovering from this COVID-19 pandemic. This data also builds on the information we released last week related to disparities across race and economic status, all of which can be seen right now by visiting chicago.gov/coronavirus. That's chicago.gov/coronavirus. In a moment, Dr. Arwady will provide further details on the data. But before she does, I would like to provide an overview on the 4 key areas that will be guiding our strategy going forward. These 4 areas and their associated metrics closely mirror the conditions under which we will consider taking our first steps toward lifting restrictions. First, We'll be focusing on data related to the number of cases and the rate of change in the number of cases. To think about lifting restrictions, we'll need to see a sustained and substantial drop in the rate of new cases. And we are not there yet. At this point in the arc of this pandemic, while the rate has slowed, new cases are continuing to increase daily. Second, we will continue monitoring ICU and ventilator capacity data over time, which otherwise reflects our health system's ability to meet the demand of COVID-19 patients in addition to our broader health efforts. Less than a month ago, we've gone from approximately 7% to 40% of our ICU beds across Chicago occupied by patients with COVID-19. We've gone from about 1% to about 25% of our ventilators used by critically ill patients with COVID-19. Our hospitals in Chicago have been stretched, there's no question, but they have risen to the challenge. They've had to expand their ICU capacity, and we've had to add ventilators into the system from CDPH's stockpile. But with that added capacity, and most importantly, because we are flattening the curve, our ICUs remain approximately 75% full across the system, and we still have half of the ventilators available if needed. The rate of increase is now holding steady, but like the new cases, we will need to see drops in this metric as well. The same goes for our third condition, our ability to administer widespread testing. We're seeing improvements in the last few weeks, but we are still not testing nearly enough people on a daily or weekly basis. This issue has been a standing request to our federal leaders, something Governor Pritzker has talked extensively about, and something that I addressed in a recent conversation with Vice President Pence. And finally, fourth, we will need the ability to have vigilant monitoring and contact tracing. And we are currently developing technology and community outreach to allow just for that. We need to build this infrastructure, and we are working on it. These four metrics are key, but there are other considerations that I know you will want to be in place to give you confidence that coming back together as families, friends, coworkers, customers, and patrons will be safe for everyone. Rest assured that we are hard at work thinking about and planning for a world in which we reopen before there is a vaccine. And a vaccine is likely not going to be available until 2021. I know these restrictions have been frustrating and challenging for every Chicagoan, but this is exactly the wrong time to let our guard down. This virus has been difficult and unpredictable at times from the beginning, and we all acknowledge that. But what we can't do, as other places across the globe have done, is come out of these stay-at-home measures too soon following some gains, only to have cases surge all over again. We do not want to make that mistake. And as we move forward, we will continue to update the public on plans to emerge, as well as to stand our economy back up, which we are also very focused on. Before I welcome Dr. Arwady to the podium, I'd like to finish by saying to all Chicagoans that we hope this data not only informs and empowers you to take steps needed to protect yourself as well as your neighbors and community. You have done an incredible job so far, and that shows in the important progress that we have been making. But for all of us to see this through, we need to continue to stay the course. We must, and you must, continue to stay home to save lives. In this moment, when we are all being tested, I think a lot about the people who every single day do heroic things, all in the service of others. Our healthcare workers, our valiant first responders, grocery store workers, and people who are attending to and feeding the sick, our seniors, our homeless, our vulnerable population, and of course, our children. Other city employees who are on the front lines every day, CTA bus drivers and train operators, our sanitation workers, and more. They are all doing their part to save every one of us. We must honor their sacrifice by continuing to stay home. And when we do, we will emerge even stronger and smarter than we've ever done before. And speaking of strong and smart, it is now my pleasure to welcome our great Public Health Commissioner, Dr. Allison Arwady, to the podium to provide further details on today's data. Doctor.
Thank you so much, Mayor. We really want to give some insight into Chicago about the data that we look at every day, our teams look at, and that we're using right now and that we plan to use going forward. As the mayor said, chicago.gov/coronavirus. Right up at the top, you can click on latest data, and you'll see all of the updates of the detailed demographics, meaning ages, gender, race, ethnicity. For cases and for deaths, we update that every single day here in Chicago. We also have updated our maps. We talked about that last week. You can go and see by zip code exactly what is happening with cases, with case rates, which is when we correct for the population, with testing, with test rates. We want to show you always the data that we are using as we direct resources where they are most needed, and to make sure that we are not missing any potential sources of infection. And as a whole city, thinking about what we need to do to continue to flatten the curve. But today is about some of the longer term data, some of the things that we've been monitoring and will continue to monitor, and we want all of you to see the same data that we're using. So as you heard the mayor say, all of you staying home has in fact saved lives already. I want to thank you for that, but to also let you know that we are a long way from done. The data that we'll be showing here will also be posted on the same website in the same place with even more detail. So you can take a look. And today at 3 o'clock, I'll be devoting the Facebook Live that I do every day to talking in more detail. So if you have questions, you can put them in directly and we'll answer them. So first of all, when we're thinking about the phases of an outbreak, I wanted to just help people understand some of what that means. At the beginning, before we're in a pandemic phase, where cases are really growing at very large rates, we work on what's called containment, which is the traditional public health work, where we follow up on every single case, and we do a lot of the detailed contact tracing. This is where, if you remember early on, we were able to talk in detail about investigations that might have involved a funeral or a gathering, and we can really see how disease spreads. Some of the investigations that we did here locally around the earliest cases, even back in January, that helped us understand some of the risks for transmission, or at the Vaughn School, that help us understand in a very resource-intensive way how this spreads. But then as cases really start to rise, and we get to a point where we're adding hundreds, 800 cases a day sometimes, we're not able to continue to do all of that containment, and we have to move to what we call mitigation. Mitigation is a fancy word for keeping the number of infections down, in a way that does involve some of these sacrifices. So the things that we've done about limiting the number of people that can come together, closing schools, the most obvious being the main stay-at-home order, some of the work that we've done around closing the parks or closing along the lakefront, those are all meant to limit the new infections through what we call community mitigation. Because if the curve continues to go on this really steep increase, we overwhelm our healthcare system. That's what we saw in Italy. That's what we've seen to an extent in New York. And all of this community mitigation work, and to the phase where we're flattening the curve, is especially about protecting the healthcare system. But as we get to the point where we are not yet on the way down, we continue to need some of this mitigation, these community level sacrifices that help us protect large numbers of people, but we also add back on more of that original containment work, the public health work of being able to do really intensive investigations. And then as we make even more progress, we move into a phase that we call suppression and monitoring, where we have to continue to follow this data to make sure that we don't see resurgences, that we don't see problems coming back. And then finally, we'll be moving towards this mass vaccination campaign and continuing to follow. And I want you to know that CDPH is already deep in the planning stages around vaccination. We've already bought the syringes. We already know where it's going to happen. We're thinking about what that's going to be. It's all part of this plan. But this is the data we'll be using. So first of all, people who look on the website will see this every day. This is a basic epi curve, it's called. It shows you day by day by day how many new cases are added. And you can see that, for example, here in Chicago right now, we are at a total of 9,666 cases. That's about 41% of the 23,000 that have been in Illinois. And you can see that those are on the upward trajectory, right? And so we're going to be following, you can see the curve right online, we're going to see that flatten out and eventually come down. But this is the data that the epidemiologists are the most pleased to be seeing, our healthcare system is pleased to be seeing, because this is the actual flattening the curve data. And if you can see, and again, you'll probably need to go online to look at the details, but if we go back 1 month, all right, March 14 happens to be the date when here in Chicago, we passed 100 cases. And when you pass 100 cases in a community, that is considered to be a community spread point. And this is the place where we start to compare different cities or states or nations against each other. We start at 100 cases. And if we look back on March 14, we were seeing cases doubling every 2 days. And in fact, even before March 14, we were seeing that. And I know it doesn't sound very scary to hear about 5 cases going to 10 cases the next day, or 10 cases going to 20 cases the next day, because those numbers aren't very big. But for the epidemiologists, the data scientists at the Chicago Department of Public Health, seeing that kind of doubling, even when the numbers are low, is why we had to be aggressive early, along with some of the other surveillance that we do, because we knew that if we didn't work quickly to start bending that curve, we were going to be on an upward trajectory that absolutely would overwhelm the health system. So you can see these red arrows show when some of the different orders went in. The shelter in place when you're sick order in Chicago, the stay at home order is the biggest one for Illinois from March 21st, the lakefront closure for March 26th. And you can see it takes time to see the effects of these. But we saw a flattening where instead of doubling every 2 days, we went to doubling every 4 days, and then to doubling every 8 days. And then here in Chicago, to doubling every 12 days. And when we're at a point where we're doubling every 12 days, I want you to understand, we're at almost 10,000 cases. That could mean that in 12 days, we could have another 10,000 cases. So this is not over, but that rate of increase, flattening, is the most important sign, and we need to get to a point where it is entirely flat, and we stop talking about doubling, and we start talking about it coming down. And we're going to get there, but we're not there just yet. Ironically, when you don't see that very, very sharp increase, you see the flattening of the curve, it actually pushes that peak a little bit later. So the reason why we're not quite at peak is actually really good news. And I know that's hard to hear, that, you know, we may need to stay in longer, we're not going to be able to just go right back to normal. But moving that peak later is the sign. It's the reason why if you or someone in your family needs to go to the hospital, gets sick with COVID, needs a ventilator, it's available, and we want to make sure it continues to be available. So let me put a little bit of a finer point on this. If we had continued to see, just from March 14th through this last Monday where we ran the analysis, if we had continued to see cases doubling every 2 days even, which probably we wouldn't have seen that, but to give you the sense, we would be today at 1.5 million cases just in Chicago. We would be at 48,000 deaths in Chicago. That would be deaths in a month. That is more than we see in 2.5 years from all causes across Chicago. So if you look on this, oh, I think it's not showing on the screen. That's okay. If you look on the purple line here shows Chicago, and you can see how it flattens the curve. The black line underneath shows what it would have looked like if we had continued doubling every 3 days. And actually, higher is worse on this, okay? We want to be low. And if you look at the difference between, right at the beginning there, Chicago was actually, we were a little bit above. We were more in that doubling every 2 days. But if we had even continued doubling every 3 days, which I think would have been a more realistic if we'd not done anything to shelter in place, if we'd not made any of these sacrifices, we could today have been looking at more than 62,000 cases in Chicago and potentially 2,000 deaths. And so while we look at our numbers now, 9,666 cases and 347 deaths in Chicago residents, trust me, every one of those numbers, like, we feel it. We know that those cases and especially those deaths have affected families in ways, you know, that are really hard. But the difference that all of this change in flattening the curve is because people in Chicago have largely done the right thing and limited new infections. If we look at how Chicago is doing and Illinois is doing, you can see here, again, lower is better, that Illinois and Chicago are both making progress in flattening the curve. Chicago's in purple, Illinois is in green, especially compared to the whole US, which is in yellow. We have seen a lower percentage of cases and deaths here in Chicago residents. We've been seeing that drop a little bit as part of the overall Illinois numbers. But broadly, I want you to know that as a city and as a state, we are absolutely moving in the right direction. I want to also just highlight at a high level some of the new data that is available on our website, which will let you look on a day-by-day basis at what our ICU capacity is and what our ventilator capacity is. We also have numbers up there about our hospital bed capacity. And so what this graph is showing is it takes you from March 19 forward through, and we ran it through April 12th here. And the full lines show the full number of ICU beds that are available across all of our Chicago hospitals. Then the darker line shows you what percentage of those ICU beds are occupied right now. The blue dots show you what percentage of those ICU beds are taken up by patients with COVID-19, either patients who are lab confirmed or who were getting tested. And so what this shows is that, first of all, if you look on the right, do you see how those gray bars actually get higher toward the right, like the overall bars? That's because our hospitals have been stretched. They've been working to expand ICU beds, making sure that they're available in other parts of the hospital, for example. But remarkably, throughout this whole time period, you see that blue line really increasing, although it too is starting to flatten. We've gone from 7%, as the mayor said, of our ICU beds taken up by COVID patients to about 40% just in 3 weeks. But overall, if you look at this, we've maintained about 25% availability across our ICUs, and that's really good news for Chicago. Similarly, if we look at our ventilators, similarly, the whole bar shows you how many ventilators there are. You can see that that has increased because we've gotten additional ventilators into the system. But the yellow line, again, shows you the COVID patients, and the darker black shows you how many patients are on ventilators overall. So you can see that during this time period, we've seen an increase in ventilators, an increase in COVID patients, but still, across the whole system, we have about half our ventilators available for use, and that also is really good news. Quickly on testing, we talked about this a little bit last week, but this is day by day by day testing. And you can see blue show us not a case and red show us a confirmed case. And this tracks from January 21, where the amount of testing was so low it doesn't even show up on this graph, to April 12. And you can see day by day by day how much that is growing. But importantly, the percentage of confirmed tests that we've been seeing has actually been relatively stable through that time period. So we need more testing for sure, but progress is being made, and there's more on the website about that. And then finally, I want to highlight a totally new set of data that we've not talked about at all yet, but that we will be using to help us understand both how our public health orders and some of these sacrifices you're all making, how those actually show up in community mobility. So we all see that the streets are relatively empty. We see that there's less traffic, but we wanted a way to really quantify how much is Chicago staying home? Because this is the kind of data that we work with our partners to put into models, to be able to say, okay, not just how did the orders in the past affect people staying home, but as we move forward and we think about opening sectors or we think about what this looks like, we want to know in advance what that might look like, and then you can fit actual data into it in near real time. So this is data from a company called Blue Dot, a healthcare company, health data company that CDPH works with regularly. And this is actually using cell phone and mobile device data. They get data from SafeGraph, and it pulls together anonymous location data from thousands of apps on mobile devices. So you know how if you have an app on your phone and you say, yes, you can use my location data, there is some gathering of that location data. In no way is there any individual data or personal data collected. We don't have it, we don't use it. But at a community level, we're actually able to use this to see how much is our cell phones and other mobile devices across Chicago staying home. What you do is you say, we're going to look back over the last 6 months. What's the location that this device is in between midnight and 9 a.m. the most? We're going to assume that is home. And then we ping every half hour through the day to see how far is that cell phone from home. Again, not an individual level data, but it lets us see, are we actually seeing changes? It's not perfect, it's not everybody. We know people leave without their cell phones. We know everybody doesn't have cell phones, but broadly it lets you get understand what this looks like. And so what this graph is showing that at baseline, back in February and early March, about 63% of the time, our cell phones as a city are at home. So we're asleep at home, we're home with our families, we're within 200 meters of home during normal times, 59 to 60%, somewhere in there of the time. But what you see, again, the red points to where some of these orders went in place, the state of emergency, the CDPH order, and then the Illinois stay-at-home order. We really see a significant increase in how much devices are at home. And we're now at a point where almost 80% of the pings, of the cell phones are sort of at home throughout the day. And that's a median, and we put it over weeks and we make some estimates. But it lets us really get a sense of community mobility in a way that lets you not only use it now, but think about moving forward. Finally, the last graph I'll show is some of this same data, but across Chicago. So we are looking at community areas. We recognize that community areas and neighborhoods have very different mobility patterns at baseline. You think about one community area may have a lot of essential workers, for example. And so this is not about neighborhood versus neighborhood. We'll be really looking at how overall neighborhoods may change. And so on the left here, we see our baseline back from early February. And you can see up on the left, that's O'Hare. Right? None of the devices are home at O'Hare. But across the whole city, broadly, we're staying home in the 60% to 70%. Again, we're sleeping, we're eating, we're at home. And then, just last week, April 5 to April 11, look how much we're staying home. The light green is in the 70 to 80%. The dark green is in the 80 to 90%. And I really want to thank Chicago, because this kind of real change in your life is why we are seeing some of that curve flattening. That curve flattening, in turn, is why we've been able to protect our healthcare system. And as we look ahead, just like we're making the demographic, meaning the details about who is getting cases in Chicago, the geographic, meaning the maps of where cases and testing are, we will be putting this data on the website for you to see the same data that we're seeing. As we look ahead to make the big decisions, obviously in conjunction with the state, we want to be transparent with you and show that we really are using science as much as we're able to with a lot of partners to make these difficult decisions. So this is a thank you, and we're not done. With that, check out the website, and I'll turn it back to Mayor Lightfoot.
Thank you. Happy to take questions. Hopefully there's on topic.
Yes,
Yes, go ahead.
Dana from WGN. So when we were looking at the graph that showed now we're at a point where cases are doubling every 12 days, is there a target number when we'll see the curve coming down? Is it double that, like every 24 days or every 15 or 18 days? Is there kind of a number you have in mind that is a goal?
So I'll start, and then I'll turn it over to Dr. Arwady. As I said in my opening comments, what we need to see is a sharp decline. And then an ending of new cases, or as close to zero as we can get to. That's what we're looking for. We can't look into the crystal ball and tell you when that is. We're constantly analyzing the data as we get it to do additional modeling. But the point of today was to demonstrate to people in Chicago that the work that you have been doing has been working. Staying home makes a difference. We're bending the curve, and we're making progress.
Yeah, the mayor's exactly right. We'll get to a point where we stop talking about doubling and we start talking about a decrease in that rate. So yeah, it'll go to every 12. We're really seeing that slowing, but we're going to get flat, and then we're going to be going down. And so that's really the goal. We have to get to a point where we stop talking about doubling rates at all, and we start talking about the decreases that we're seeing.
When we've been hearing from the governor each day on the updated numbers and the new cases, it seems over the last few days the numbers have been pretty consistent, but still over 1,000 new cases a day. When you look at the graph behind you with 80% average of people who are, hopefully obeying the stay-at-home order, how do you interpret these new cases and these new infections? I know it's hard with the contact tracing, but are these, cases that you think are passing within family to family, people not obeying, or essential workers who are still out in the community?
Well, I think it's all of the above. We know from probably at least 3 weeks ago that we had community spread cases. So we focused initially on the people that were travelers that were coming back from other parts of the world that had it, and then we started it being cropping up where when CDPH did the investigations, they couldn't tie it to a travel situation or somebody inside the home. So we are now in community spread, and we have been there for some time. So we're going to continue to see the cases rise. But as the doctor indicated, a couple of metrics that are important. What's the rate of the rise? We went from every 2 to 3 days to now we are in 12 days. What's the amount of ICU beds that are taken up by COVID positive or people under investigation for COVID? What's the use of ventilators for those same COVID patients? So when we see those numbers start to stabilize, as we've been seeing, that's a positive sign. But I want to reemphasize, again, we are not out of the woods on this thing.
Yeah, and I would just add that, one of the hardest things I think for people to understand is that once the numbers get big, they're big. And so if I sort of take the Illinois numbers, they're at 23,000 cases overall right now. So if they were doubling every 10 days, for example, you would think about adding 10% of that number a day. So if they add 2,300 cases, they're actually on a 10-day type trajectory, right? It's a little more complicated than that, but it gives you the sense that we are going to see big numbers here, because that's how this disease and how the spread of it works. But I don't worry so much about seeing a number over 1,000. I want to see progress, and we have been seeing progress, as I believe the governor talked about yesterday, in terms of how quickly that rate is increasing.
And when it comes to increasing testing capability, I believe that was one of your 4 bullet points that you would consider, or that you want to consider when lifting restrictions. We had heard the governor's goal was processing 10,000 tests a day. Is that the number that you want to see, or is there a certain number of tests as far as the capacity goes when you think of lifting restrictions?
I want to.
Yeah. So again, there's a lot of complications within that question, because we are interested in, first and foremost, making sure that we're able to test anybody who has symptoms, right? And that is one particular type of test, and we need to get to a point where we're not having to turn people away or encourage people not to get tested. So that's one bucket. Secondly, as we think about some of this serology testing coming available, it is not FDA approved at this point, I want to be clear, but we expect that to come very soon. And just last night, I was on the phone with a lot of the top federal folks, because we had a conversation with a lot of the big cities about testing and what are some of the plans at the federal level. And we need to ramp up sort of both the ability to test people who are sick and, in a more what we call surveillance way, be able to understand at a population level, do people have they seen COVID before? Have they mounted some immune response to it, to understand sort of how that is spread? So I don't set one particular number. We will have some specific, what we call surveillance targets, where we'll want to be testing. It's not just like who happens to get a test. We want to have a systematic way of knowing that we're able to sort of compare apples to apples in terms of how much testing is happening. So I don't have just one number. We have, internally we have some general numbers that we're aiming for, of course, but I want to make sure the different kinds of testing are happening in the different ways, and frankly, we want to make sure, I'm equally interested in making sure that our testing rates and locations are matching where we're seeing cases. So more than setting kind of one number for the city, we really follow things like our race ethnicity related to testing and our geographic locations, and have been doing a lot of work to understand where there may be gaps there, because I'm most interested in making sure that increases in testing happen in a way that doesn't, first, that people have access, but also it doesn't make our data look different than it would otherwise, because one part of the city may have better access to testing. So it's a complicated question, but I promise we've got a lot of metrics, and we'll have more time in the weeks to come to explain more about the details of how we're tracking that.
And if I can just add a few points on that and pick up on one thing that Dr. Arwady said, which is really important. What we are doing is obviously looking at the impact of this disease across zip codes, across neighborhoods, across demographics. So, for example, if there's going to be more testing in Chicago, it needs to be driven by the data and where the need is. We're very focused on looking at places where we're seeing higher rates of infections, looking at places where we're seeing higher rates of death. So the testing needs to be in those places where there's the greatest need, not just plop down anywhere. That's critically important.
Today, the mayor of New Orleans announced that she's recommending all large events and festivals be canceled through 2020. Do you have any updates? I know you were asked about summer events here recently. Is that something you're still thinking about?
Yeah, look, we're looking at the long term, but I'm not in a position as we sit here today to talk really about the summer. We're trying to focus on where we are in the short term, but obviously we have an eye towards what's going to be happening in the summer and the fall, and I'm thinking already about what things we need to do, for example, to make sure that the November election is done in a way that's consistent with public health guidance, so that we avoid some of the challenges that we saw with the March 17th primary. But I have a great deal of respect for Mayor Cantrell. I've gotten to know her over this last year. I mean, they are in the eye of the storm down there, as we all know. So I understand why she would have taken this step now. We're looking at a lot of different things in the coming months and what we can and should do. But when we're ready to make those announcements, certainly do that. But we're going to do that in partnership with the industries and the workers that are directly affected by all these large-scale events that would normally be taking place in Chicago.
And this question's from Sarah Schulte at ABC7. She asks, some suburbs are ordering people to wear masks in certain public locations. Are you considering changing mask wearing from a recommendation to an order in the city?
Well, look, I think what people need to do is obviously what makes them comfortable. And as you know, walking down the street, going into essential places like grocery stores or pharmacies, people are wearing masks. I think the guidance that we've given is the right guidance, which is if you cannot social distance comfortably, or if you otherwise feel like you need that, wear some kind of face covering, and people are doing that.
Chris Pratt from the Chicago Tribune asks, several residents called for General Iron to be shut down during the coronavirus stay-at-home orders. Why didn't you close General Iron during this crisis?
Well, I think several people who were prompted to talk today at the City Council meeting said that, look, we've been aggressively looking at General Iron and other manufacturing sites. The first and foremost defining of the essential business was done by the governor's order. But having said that, we are looking at General Iron and other places across the city that have historically been concerned. We're checking air quality. We're looking at particulate matter. We've already had a conversation today, and as a follow-up to some of the things that we heard this morning, if we need to take decisive action, I think I've demonstrated that we won't hesitate to do that.
Okay, and this is my last question. This is from Ben Bradley at WGN, non-COVID related, but he asks, it now looks like it'll be more than 6 months since the Eddie Johnson incident, and there's still no IG report on what happened. Do you think that is demonstrating the level of transparency you frequently talk about, and will you commit to making the report public?
Well, look, I don't control what the IG does. But I will say I've been extremely unhappy that it has been this long and we still don't have an IG report. I had my team reach out just last week to say, where is it? So that's a question for the IG, but it's time to get that done so we can move forward.
In the interest of time, I'll be only asking one question per reporter that came in. This is a question for Dr. Arwady from Katie Foodie at the Associated Press in Chicago. Is CDPH hiring or retaining staff to work on contact tracing teams? If not, does the agency plan to do so, and what is the timeline for that work?
Hiring or retraining, was that the question?
Or retraining.
Okay. So definitely we've done a lot of retraining and we've done some hiring. This has been a response that started within not just CDPH, but within the communicable disease section of CDPH, which is a relatively small number of hugely talented people who very quickly had to expand beyond that. And so we've done a lot of retraining and pulling in really the whole rest of the department, obviously, on some of this COVID work. And then now we're really looking beyond the department. We've done some temporary hiring. We've worked with a lot of partners. We've been getting volunteer help. But I do think we'll be looking even more aggressively and in a long-term way about what this is going to look like as we make sure that we, again, add more of that containment, the traditional public health, back onto the community mitigation. So I'd say stay tuned. We're doing well from a workforce perspective, but there is a lot of work to do and a long way to go.
Question from Fran Spielman at the Sun-Times. What is the running total now on how much the city has spent on its response to the coronavirus? Last week it was $100 million. And how much more money do you need from another version of federal stimulus program to avoid raising property taxes?
Well, as we said last week, we expect the final tally to be in excess of $100 million. Certainly, we're going to be looking to get reimbursement from the federal government for as many of those dollars as we possibly can. And we have already started the conversation with the federal delegation, our senators, and our state representatives about what's going to be needed to make sure that not just Chicago, but municipalities all over the state are compensated and made whole from the loss of revenue. So that conversation is ongoing.
Question from Mariano at Univision. Are there any results of the air pollution analysis in Little Village?
So the laboratory sampling and work has begun. In the samples that were collected, I can tell you that there has not been any asbestos, any of the different forms of asbestos detected, which is very good news. And additional work is happening in the laboratory. A lot of the air data is still being collected and will be, will be shared in the days to come as that analysis is done.
Question from Dana Koslov at CBS 2. Mayor, how do you think the virtual city council meeting went today in terms of effectiveness? And do you think it's something state lawmakers should consider doing at this time?
Well, I'm not going to opine about what the state legislature should or shouldn't do, but I know that we in Chicago needed to get on with the business of the city. There was a lot of time and effort put into making sure that we could have a virtual city council meeting where all members could be seen and heard, and that the public would have a meaningful opportunity to participate. And with those goals in mind, I think we did a good job today, and we really have to commend everybody that was involved, including the aldermen and their teams, as well as people from our technology shop and the mayor's office who really made this possible.
This is from Shia at Politico. Mm-hmm. Mayor, will there be any changes made to all construction work being considered essential?
Well, again, the what is and what is not an essential business is really defined by the governor's stay-at-home order. Obviously, with construction projects being defined as essential, we have been doing everything we can to both educate the general contractors about what their responsibilities are to their workers during this time of a pandemic. Things like making sure that they have masks, social distancing where possible. Where not possible, making sure that they've got protective gear like goggles, gloves, masks, and so forth. That work is going to be ongoing, and we've encouraged workers where they feel like those protections are not in place to make sure that they contact us so that we can send inspectors out on the site and make sure that employers are working in a way that's safe for the workers. That's always a priority inside or outside of a pandemic, but it's even more important now that workers are protected.
Mayor, a question from Craig Dillamore. Mm-hmm. What, if anything, would you change about today's City Council virtual meeting as a follow-up to the original question you had?
Well, I actually think it went pretty well. As I said, we were obviously concerned about making sure that the technology was going to be able to work, that people from the public were going to be able to see it and be able to be heard through the public comment. I haven't seen yet kind of an after action to make sure all the technology worked, but at least from an end user perspective, it seemed to work pretty well. And as I said, there's a significant amount of time that's been put in over these last few weeks to make sure that today was going to be possible. Next phase is moving to City Council committee meetings, as well as then the full City Council meeting again next Wednesday.
Mayor, question from Shruti at Bloomberg.
Yes.
What do you want to see in the next federal COVID response funding bill that applies to Chicago?
Well, I think there are a number of things. One thing that we have learned is, for example, some small businesses are really struggling because the increase in the amount of unemployment insurance available, also lengthening the time period. There are some workers for whom it is better for them to leave their employment and seek unemployment benefits, although we know that getting unemployment benefits has been a challenge not only here in Illinois but across the country. So that was a nuance that was new to us that we just started hearing about from small businesses. And while I'm talking about small businesses, they're still really, really struggling. Getting access to the small business loans. But what I know small businesses want is more grants than loans. And one of the challenges so far that I hope works out is that the banks that are really facilitating the small business loans are really focusing on their customers first. So in Chicago, for example, we have a lot of businesses that are unbanked, meaning they don't have an ongoing banking relationship. Their businesses are cash business. And of course, we have businesses that are owned and run by folks who are undocumented. The undocumented people we know are not going to be able to get access to the federal resources, but really infusing a lot more cash into the hands of small businesses so they can survive this and come out on the other side is going to be critically important. I mentioned earlier that we were very focused on making sure that municipalities not just get reimbursed for COVID-related expenditures, but looking at the impact that this pandemic has had on revenue streams in places like Chicago, of course, but really all across our state. I'm hearing that from mayors in our region with whom I'm in regular conversation. This is a scary time for them because a lot of economically sensitive revenues are really being impacted. And depending on what your mix is of revenue streams, this can be very dire circumstances for localities. So that's something that has to be taken into consideration. I think other things that I worry about and we're talking to our delegation about is housing. Of the affordability of housing, paying rent, making mortgages. I'm very worried about a new wave of mortgage foreclosures that might be at our doorstep as a result of this issue. So those are some of the things that are really kind of top of mind for us. It's a long list, and we are working to qualify and quantify them so that we can articulate them in a formal way to our federal delegation partners.
Great. Question from Omar Jimenez at CNN. Mm-hmm. And an invoice out of the state comptroller's office shows multiple payments made by the state for flights to China to help with the COVID-19 response. Was this ever something that was discussed as a possibility between the governor's office and yours? And has the city ever explored options outside the state for help in acquiring PPE or other supplies during the pandemic?
Obviously, the state had a separate procurement process that the city was not a part of. We have been fortunate because our Department of Public Health really stockpiles all year round. So things like PPE, things like ventilators that are critically important in fighting COVID, we've been well positioned here in the city of Chicago. Now, that doesn't mean that we haven't looked for other opportunities to expand the amount of resources that we have in our stockpile. We have. And we've been very fortunate as well that a number of people have stepped up and come to us, so we haven't had to do other efforts. There have been people that have been extraordinarily generous in donating resources to the city, to first responders, to healthcare workers. So I feel like through this we've been well situated, but I want to ask Dr. Arwady to provide a little more detail to this discussion. But we have been holding our own as a city, but nobody has gotten the amount of PPEs and other materials that have been needed to fight. We were, a month ago as the focus of this press conference, very worried about rates of hospitalizations that would really overwhelm the system, and then thinking about what that meant and what was going to be needed in the normal course. For example, we don't provide PPE to hospitals, but the Department of Public Health has provided millions of pieces of materials to hospitals. So all of these things are important to make sure that we are doing everything we can to keep our residents safe, support our healthcare system, our first responders, and our vulnerable population. Doctor, I don't know if you want to add to that.
Yeah, I think I would just add, you've heard me talk about how grateful I am that our emergency preparedness team at Chicago is really one of the top in the country. And it's like I look back and I say there have been years where I've said, boy, we spend a lot every year, because it's not just over the year. I mean, for years we've really been working to make sure that we would have the materials for a pandemic, just like we plan for other really large-scale events. And questions about do I really need forklift drivers? Like, do I really need to be paying for warehouse space? Like, these are expensive. We make sure we keep them temperature controlled, et cetera. But when this happened, knowing that we had a stockpile of supplies that had been kept in absolutely tip-top shape, and that we had practiced actually delivering them to especially our hospitals, meant that we could start very quickly getting all of that out to our healthcare system and to our first responders. Now, one thing that's been different here is that we've had a whole lot of other needs in Chicago that go beyond the traditional healthcare system that our planning's for. So, for example, we had to make sure, and we have gotten PPE to every long-term care facility, right? We've had to make sure we've gotten it out to homeless shelters and to other congregate type settings. And ventilators very specifically. I mean, we did have actually here in stockpile around 150 or so, but when we were looking at those curves a couple of weeks ago, and we did have some of the smaller hospitals really down to sort of their last ventilator or two, really asking very specifically with really specific data saying we need ventilators and we need them now, able to get, eventually 300 ventilators from the federal stockpile, and we got those right out into the hospitals. And knowing that we've been able to start from a relatively strong place and then be, I really thank all of the folks at, the Emergency Management Center. Really, this has been a big effort at the city. It's been a huge effort at the state. It's been a huge effort at the federal level to make sure that we can keep people protected, especially healthcare workers, and they need to be. So I think we started from a fairly strong place, but it's a thing that everybody is continuing to work on.
Last two questions, one from me and then one from Dana. This question is from Kelly Bauer at Block Club Chicago. What did you say to VP Pence, and what did the feds tell you about testing?
I think I've said before that it was a very cordial conversation. Of course, I advocated for things that we needed in Chicago, like PPE, like more testing, like ventilators. I also strongly encouraged the Vice President to establish a bipartisan, geographically diverse group of mayors who could help provide a local voice to the work of the task force. I had sent a letter prior to that conversation making the same kind of argument. I brought it up again when I had the conversation with him. So far, they haven't taken me up on my suggestion. But what I hear from mayors here locally, but also across the country, is we are on the front lines. We are the ones that have to implement and respond to our residents, and it behooves everybody at all levels of government to make sure that the mayor's voice is at the table, because ultimately we are the ones who are responsible and must be responsive to our residents. So that's advice at the federal level, but applies with equal value elsewhere as well.
This is just a question, and I apologize if this has been explained. I haven't heard an update on the alternate care facility at McCormick Place. Given the numbers that we saw today with the available bed capacity, ICU capacity at Chicago hospitals, do you anticipate needing that space in the long term? I think the plan was 3,000 beds. Mm-hmm. Is that still the plan to scale it up to that level? And how long do you want to keep that alternate care facility in place?
Well, keeping in mind what's the principle behind McCormick Place, that is to have a release valve for hospitals. Obviously, we're seeing a different set of numbers than we saw, 2+ weeks ago when we really started the sprint to get McCormick Place up and running. We're just starting to see the first patients arrive there, but we will be making any necessary adjustments based upon the data that we're seeing. As I hope the big takeaway from today is, while we've made progress, we are not out of the woods by any stretch of the imagination. But those are conversations we're having on an ongoing basis with the leadership at the McCormick Place alternate care facility, and we are mindful, as they are, of what the data is showing us and what the needs are. But we certainly want to make sure that this resource remains in place for the foreseeable future, because if we have that need, then we don't want to have to be scrambling to get the space. So I'm grateful again to the Army Corps of Engineer. I mean, they have been absolutely tremendous. I'm grateful to the Illinois National Guard, who are also very much involved in setting up the facility. The Illinois Emergency Management Association has played a big hand. All the tradespeople that are out there, it's been tremendous. Loretta Clark, who's the CEO, MPEA, and I also have to give thanks to my team that's been on the ground there every single day for the last 2+ weeks, making sure that we were standing up the facility, getting all the SOPs in place, working with the medical team to think through what the staffing model was going to be, in communication and coordination with the local hospitals, who this facility is intended to be a relief valve for. It's an extraordinary amount of work that's been gone into standing up that facility and being ready as we are now to take the first patients. And I just think the work has been really, really tremendous, and I salute all involved.
Thank you, everyone.